one of the main challenges that the health sector faced, and if you compare across agriculture, education, the health sector is actually the one that gave us an experiment of success or failure in devolution, because the Ministry of Health actually, for some reason, really engaged, and there was transfer of budgets, transfer of things very early on in 2013, and as other sectors and sub-sectors caught up in implementation. But on the issue of Health Services Commission and the grounds which have been advanced to support that, you know, and this goes back to what Governor and Senator have been talking about, the joint management of critical services in the country. So, for instance, training and capacity building. Let me take that example in the health sector. So you have training standards. Yeah, we want doctors who can treat anyone, anywhere. And this calls for some national minimum standards in terms of capacity development. Yeah, not just universities, but when on-job training. And this is actually to be coordinated from the national level. But what happened is that standards of training, quality assurance, promotions, and the standardization of that was not addressed well from the start. So therefore, we had the transfer of doctors, transfer of payrolls without harmonization, and then there is now the budget cycle challenges that county governments face. You know, what could have been done, for instance, HR management as a component of management of health professionals could have been deferred until there are structures to harmonize training, capacity development for some time. What happened is that this was done big bang. Yeah.
So what do we do now?
So one of the solutions, like the health professionals, if you ask any nurse in any county government, typically they'll tell you for the last 2-3 months we have not been paid. We are assured this month the salary will delay and all that. And if you ask the governor and the health minister, the county, what is happening, they tell you basically it is transfers from the which are not happening. But my view is that going forward, and the two levels of government actually critically discussing how to ensure quality services in the health sector and which components need to be managed well. So at the end of the day, you may go for the Health Services Commission, but this is an intervention to stop an immediate challenge that health professionals are facing in the sector as a result of this, the effects of the mismanaged transition process. And actually, the national government and county governments need to lead discussions on standards, especially in HR management, so that a doctor in Turkana, a doctor in Tharakanithi, a doctor in Isiolo, in terms of promotions, maybe sometimes remuneration, in terms of quality assurance of services, that especially the Ministry of Health and its evaluation teams are on top of this. The other thing is sharing of critical resources. Or critical human resources in the health sector. So we may, first of all, if each county is to employ, for instance, cardiologists, we may not even have that number of cardiologists in the country. And even if we do, you might end up paying salaries of cardiologists and forget primary health care. So there's a way in which the Ministry of Health and counties should place or locate critical strategic health services in the country, make use of the former provincial government hospitals, cancer centers, and specialized treatment that cannot be devolved to the very low levels because of the expenses involved and the budget support that will go with that, and even the technical capacity in the country, which is limited. If we are able to set standards on the levels of services needed, equip institutions that are to offer those levels of services, and then have arrangements. Like, for instance, there's a special grant in the national budget that goes to the provincial health hospital so that it pays for these critical services, because you find like the PGH in Nakuru serves people from Bomet, Kericho, and all that. So therefore, the ministry, and many of the county referral hospitals, because not all the 47 counties have county referral hospitals, they serve from across the county. They have kidney centers, you know. So those, if we can have a policy on management of strategic health services, and then you ensure that primary health care is devolved to the communities, and they have the personnel and competence, plus what Governor Kangata was talking about, the community health volunteers. That is part of the primary health care. Those can be in every county and reach every village, because the resources required are relatively easier than the other critical services. So those arrangements. Okay. And then things like, let me re-emphasize that human resource management, the Ministry of Health, in consultation with counties, has to take care of that aspect to ensure that there's motivation among health professionals. And if the option is a health services commission because of the practical challenges we face, then define what that does, its relations with county governments. Yeah.